Micah. How are you doing today?
Good.
I'm Liliana. It's nice to meet you.
Nice to meet you.
So, you were just diagnosed with diabetes, right? I'd like to talk to you a little bit about that, okay? It's good to have a little bit of information. So, with type 2 diabetes, mellitus is what you have. Your body does not use insulin properly the way it should. This is called insulin resistance. It's the body's inability to respond to and to use insulin as it produces. Insulin resistance can be linked to obesity, which means overweight, hypertension, which is high blood pressure, and high levels of fat in your blood. This occurs most often in people with type 2 diabetes, but it can also occur with people that have type 1 diabetes. At first, your pancreas makes extra insulin to keep up, but over time, your pancreas isn't able to keep up and can't make enough insulin to keep your blood glucose levels normal. Type 2 diabetes is treated with lifestyle changes, oral medications, which are pills, and insulin. Some people with type 2 can control their blood glucose with healthy eating habits and being active. But your doctor may need to also prescribe some oral medications and insulin to help meet your target blood glucose levels. With type 2 diabetes mellitus, it can get worse over time. Even if you don't need medications at first, you might need them later on, okay? Some symptoms your doctor looks at that you may report are the need to urinate more often, or you need to pee more often, extreme thirst or hunger, blurry vision, or having sores that won't heal, being weak and fatigued, like you just don't have no energy. He can also order some tests to make sure that your glucose levels are good. So they can do urinalysis to check for ketones in your urine, fasting plasma glucose test, which is your A1C, and it usually lets us know how well your sugar has been controlled over the last 3 months. A random plasma glucose test, which he might have you check your blood glucose a couple of times now that you've been diagnosed. Also an oral glucose tolerance test. You'll fast for about 8 hours and then drink a sugary beverage and see how your sugar comes out with that one. So we talked about the diet and lifestyle changes to keep your levels normal. So now that you're going to be checking your home blood glucose at home, your doctor will tell you when and how often you check your blood glucose levels and what your levels should be. You should keep a daily record of your levels. If they're too high or too low, let your healthcare provider know. Some of the possible complications that can happen with diabetes are low blood sugar or hypoglycemia can occur in people taking medications for diabetes. Severe hypoglycemia can be dangerous because you can pass out. Signs to watch out for are feeling dizzy, nervous, weak, and shaky. You can also sweat, feel sleepy, confused or hungry, or have trouble speaking. If your blood sugar level is less than 70, eating or drinking any of these foods that I'm about to tell you can help bring your sugar up, okay? So 1/2 cup of any fruit juice, which is 4 ounces, 1/2 cup of regular soft drink, 1 cup of milk, 1 or 2 crackers, 5 or 6 pieces of hard candy, or 1 or 2 teaspoons of sugar or honey. So with the hard candy, it can be like Lifesavers or something like that. Always try to keep something with you, even if you're just going to be out for a couple of hours, because you never know when your sugar can drop. You can check your blood sugar level again in about 15 minutes after you eat something or drink something. And if it's still too low, have another serving. You should always carry one of these foods with you, okay? Another possible complication of diabetes is hyperglycemia or high blood sugar. It can cause poor vision, slow healing cuts and sores, skin infections, and nerve damage. Early signs can include thirst, headaches, trouble concentrating, blurred vision, frequent urination, weight loss, and feeling weak and tired. So changing your diet, some of the things you can do is we can refer you to nutritionists that can help you plan out your meals that are low in fat, salt, sugar, and cholesterol, and cut calories if you're overweight. Some of the modifiable things can be stopping smoking and exercising regularly. That can really help keep your blood sugar level stable. So you always want to check your blood sugar level before and after exercise. And always carry a carbohydrate snack with you, like crackers, to eat if you feel weak. So problems if your diabetes is not treated right or it's poorly controlled, it can cause damage to your eyes, your nerves, your kidneys, heart, and it can also cause erectile dysfunction in men too. Make sure and take your medication as it's prescribed. Have a complete eye exam at least once a year. Make sure and take care of your teeth because you're more at risk of getting cavities and gum disease. Protect your skin. Make sure and check it daily, especially your feet. You want to be checking for dryness, cuts, any redness, or any changes. Make sure and drink plenty of water. Keep an eye on your blood pressure and your weight. The ideal blood pressure is less than 130/80. Watch your blood cholesterol level. Have it checked at least once a year whenever you see your primary care provider. It should be below 200. Make sure and try to find a support group to help you get through this because sometimes you have questions or it's very difficult to live with diabetes. Do you have any questions for me right now? Okay. If you have any questions, please let me know. Some groups have a higher risk of developing type 2 diabetes. It's more common in African Americans, Latinos, Native Americans, Asian Americans, Pacific Islanders, as well as the age population. Native Americans are twice as likely as whites to have diabetes. And about 2 out of 3 Native Americans with kidney failure was the highest of any race, and diabetes was the cause of their kidney failure. As is true for Americans of all ethnic backgrounds, American Indians and Native Alaskans now consume a diet that is highly processed foods, foods that are higher in fat, particularly saturated fat, and higher in sodium, added sugars, and dietary cholesterol. You want to try to limit those foods. You want to try eating more healthy and more balanced diet, more fruits, vegetables, and some protein. So some of the people that can be involved in your care now that you have diabetes, it's your primary care provider, and he's there for your general checkups and when you get sick. You can also see an endocrinologist, which they specialize in diabetes. A nurse educator or a diabetes nurse practitioner, they're really great to help teach people with diabetes if you need that extra support or help. Also the dietitian can help you figure out your nutritional needs that you need. Like I said, the eye doctor is very important. You need to get your eyes checked. Also, living with diabetes can be change your life drastically and a lot of changes. So you might need to see a mental health professional and they can help you with any personal or emotional side of living with diabetes. Social worker can also help you find resources to help you with your medical and your financial needs. So this is just some of the things that you need to watch out for with diabetes and the medications. Once you start needing to transition into having to use insulin, we can go over how to use it, where you do your injections. Also, we'll check, make sure that you're able to check your blood glucose levels today before you leave, and make sure that you don't have any questions and concerns for me. Do you have any questions? Okay, well, thank you for letting me talk to you today, and I hope that we can get you on the right track, and maybe we can control your diabetes right now since you've just been diagnosed with just exercise and diet changes, okay? And if we need to, the doctor can always start prescribing that medication, such as metformin and insulin later on if you need it. All right, thank you so much, Micah. It was a pleasure meeting with you, and I'll be back shortly.